Good afternoon, everybody. My name is Caregivers. At exactly 4 p.m., we will start today's webinar. Thank you so much for your time. The webinar on diabetes will start shortly. Thank you. Good afternoon once again, everyone. My name is Caregivers. Welcome to the diabetes webinar put together by Clina-Lancet Laboratories in partnership with Lagos Executive Cardiovascular Center. My name is Caregivers and I will be your host for today. As we all know, diabetes is such a major menace in our society, and there is so much for us to learn. There is so much for us to know about diabetes. And the good thing about today's webinar is that we have brought together experts who will not only give presentations, but will answer your questions, your concerns, and everything that you would like to know about diabetes. Today is not just about the patients, it's also about the caregivers. I know personally that with diabetes management, it's really beyond the patient. It's also about the caregivers. It's also about the family members. It's also about the wife of a male diabetic patient. It's also about the children, those that will cater to this particular person who is living with diabetes. We have so much in store for you today. I mean, I'm really excited just looking at our agenda and everything that we have today. But before we go into the presentations, the panel session, the Q&A session, I'd like to introduce the Managing Director and the CEO of Clina-Lancet Laboratories in person of Dr. Olayemi Daudu to assist us with the welcome address for today's webinar. Dr. Daudu, you have the floor, please.
Hi, good evening, everyone. I'm excited to be here today on this very important topic, and we all know how it's affecting all the age groups. So now we're not even looking at adults, but we're seeing a lot of children that are coming down with diabetes. So I'd like to say good evening, everyone. And on behalf of Clina-Lancet Laboratories and the Lagos Executive Cardiovascular Center, I'd like to welcome you all to today's webinar. Diabetes indeed is becoming an increasingly prevalent disease, and knowledge of its management is tainted with lots of misinformation. Our goal today is to help patients and their caregivers learn from the speakers how to live well with diabetes. We'll also address diet, nutrition, as well as care and management of the disease. Now, what caregivers should know, as well as the other key areas that have to do with diabetes, are very, very well-informed speakers will also address our questions and concerns during this event. I'd like to thank you all for joining us, and I look forward to a very insightful webinar. Thank you very much. I hand over back to the moderator.
Thank you, Dr. Daudu, for that brief welcome address. It's great to be here. Without further ado and without wasting too much of our time, we'd like to go right into our first presentation for today. And our first presenter is none other than the Chief Medical Director of the Lagos Executive Cardiovascular Center in person of Dr. Folashade Ali. She will be giving us a presentation on the care and management of diabetes. Over to you, Dr. Ali.
Hello, good afternoon, everyone. the moderator. Can you all hear me?
Yes, we can hear you.
Yes, we can.
Okay, so you're welcome to the webinar this evening on diabetes, treatment, management, and talking to the patients. I believe I'm talking to patients and at this point in time. So it's going to be very simple and straightforward with regards to this presentation. My name is Ali Folashade. I can't see the presentation. Give you a second.
Dr. Ali, please go ahead with your presentation while we try to, I believe you're trying to resolve your slides presentation. Please go ahead with your presentation and we'll work back end to resolve that. Thank you so much.
Okay, you're welcome. I'm going to talk using this scope, diabetes overview, preventing diabetes, managing diabetes, the risk factors associated with diabetes, early detection and the treatment, and then the role of caregivers in the management of diabetes. Diabetes, as all of us know, is a serious chronic medical condition characterized by elevated blood sugar, blood glucose level, and this occurs when either there is absolute absence of insulin, or there is a which we find in type 1, or there is a relative absence of insulin, which means the insulin is there, that the body cannot effectively make use of it, which we call the which happens in the type 2 diabetes. Next slide. This picture shows the diabetes is one of the 4 major non-communicable diseases worldwide, and we can see that it's reflective mainly on the what we do, our lifestyles. Use of tobacco, unhealthy diet, physical inactivity, excessive intake of alcohol. So it's reflecting much on our lifestyle. And then by the WHO statistics, there is an exponential rise, in fact, both in the incidence and the prevalence of diabetes. It's just continuing to rise. And this is more so if you look at this graph. I hope, is everyone seeing my graph? Hello?
No, we cannot.
You cannot.
I'm not able to see the shared slides yet. I think that's what the moderator was saying should fix.
Okay. Okay, so that's what the moderator is trying to do. Okay, so, but in recent times, this non-communicable disease of which diabetes falls is now going to even be more seen in the low and middle income countries, where our Nigeria is. That is, in the coming years, there are going to be even more and more increase in prevalence of diabetes. By prevalence rate, I mean both the old ones and the newly diagnosed cases are going to be more and more in coming years in low and middle income countries, whereby Nigeria falls. So it's going to be an enormous condition. And it's quite, it's something that we need to begin to talk about, something we need to talk about our lifestyles with regards to this condition. The complication of diabetes is it's from the head to the toes. I always say that diabetes should be named a cardiovascular condition, in the fact that, in fact, it is a paramount thing to the cardiologist when it comes to diabetes. because diabetes affects the heart and its blood vessels. In fact, the blood vessels right from the brain, from the scalp, from the skin of the scalp to the toes of the legs. And it's simply because diabetes is another major cause of arteriosclerosis. It affects the vessels right from the head, from the skin of the head of the scalp right to the toes. So it's a condition that affects, complicates, that has all these complications from every organ in the body. And from this picture I projected, we have it causing stroke, blindness, heart attack, heart disease, heart failure, peripheral vascular disease, what results into what we call a gangrene of the toes, almost leading to amputation of toes, auto amputation, even requiring proper amputation by the orthopedic surgeon, deadened nerve. I've once seen diabetes whereby they wear the pair of shoes, enter the car, and when they are coming out of the car, they come out of the car, barefooted, because they couldn't even feel that they are no longer wearing their shoe. So it's a very, very bad condition. So it affects the nerves, affects the vessels, affects every organ in the body. So by the WHO statistics of the year 2019, when it was released, for 3% of that under 70 years of age was caused by diabetes. And there has been an increase worldwide in the deaths due to diabetes, mortality due to diabetes. And WHO noted that from 1.5 million to 1.7 million, to 3.7 million in year 2019. So that is worldwide figure by WHO. So this is going to be, and it's not stopping. It continues, it keeps counting. But we can, you and I can do something to this by what we're doing today, educating ourselves on the importance of this disease, what you and I need to do as patients, as caregivers, as individuals, because it's a disease largely due to lifestyle. Although there is there is some inheritance in it, but of course there's an adage that says if you are liable to something, then you can help yourself by doing what is right from the beginning. So, of course, as I said earlier, diabetes is disease of lifestyle. When you don't do the appropriate thing. Of course, we have what we call, also in the development of diabetes, we have what we call non-modifiable risk factors. As I said earlier, family history of genetics, as inheritance. As you grow older, you are likely to have diabetes. Gender differences is also there. It affects more women than men, but after a certain age, both men and women are becoming affected equally. That's after the age of menopause. So all these are there. And as I've said earlier, modifiable risk factors include being overweight. If you are overweight, know that you are more susceptible to this condition. If you have high blood pressure, it also increases the risk of having diabetes. If you have, and of course, diabetes, which is largely elevation of blood sugar level, also affects other blood, important blood elements like cholesterol, high glyceride. If you have high triglyceride, high cholesterol, then those are all also metabolic conditions. There's likely you're going to have also high glucose level. Of course, physical inactivity, if you are always sitting, that sedentary lifestyle is also a high risk factor for developing diabetes. Poor diet, consuming a lot of fat, consuming a lot of salt, consuming a lot of carbohydrates. When you don't know when you are not careful about eating well. In those days, when you eat poorly, when you eat poorly, you do sedentary, you are having sedentary living, then it's likely that you're going to become obese, and then this increases your risk of developing diabetes. If you remember with me, if you want to go down the memory lane, in those years back, our televisions used to be big, and we hardly watch television. But now televisions are slimmer, and people sit down hours watching television and in the eating, and they become bigger and their weight increases. So this lifestyle issue that we all need to begin to do a better thing. So preventing diabetes, therefore, you need to get into having regular exercises, maintaining a healthy weight. Know what there's what we call body mass index, BMI, calculating your weight, dividing it by the square of your height, and then gives you a BMI. Anyone that has a BMI over 25, you become a risk target for developing diabetes. So we need to also go into proper diet. When your food is colorful, then you're on the right path. Colorful meals. Then you're on the right path to preventing diabetes. Of course, also of utmost importance is regular checkup. Diabetes fall also under a group whereby it is symptomless, in a condition like if you diagnose a patient with high blood sugar today, it's most likely that the blood sugar has been elevated in the last possibly 3, 4, 5 years without the individual knowing. Might not have any symptom, might just be a routine checkup or something else that picks up the high blood sugar. So again, a check on your health. I always say that absence of symptoms does not mean all is well. Absence of symptoms does not mean you are healthy. You need to check yourself up. Check your blood sugar, check your blood pressure, check your weight, check your cholesterol, check your all these important things, because they don't have symptoms, but they are there, and they are destroying the organs as long as they are not controlled. So we advocate that early discovery, when they are detected early, early intervention, early institution of management, early institution of what you need to do, prevent end organ damage, and gives a longer healthy living. As I said earlier, diabetes affects every part of the body, but of utmost importance is the feet. Foot care in diabetes is of utmost importance. Therefore, if you are diabetic, for example, you've been known to have diabetes, examine your foot. Personal examination of the foot is very important. Try not to subject your foot to cutting by anyone. Try and make sure you don't have a wound on your legs. Don't cut your feet, because sometimes diabetic, if it has been on for some years, the individual have some visual impairment, and then with visual impairment, you now want to begin to cut your nails, and with nerve deadening, that's neuropathy, you don't know that you are even cutting already your flesh, and that is the beginning of trouble. So a special foot care program is available, for diabetes in Lagos Executive Cardiovascular Clinic. Therefore, in diagnosis of diabetes, individual first need to check your blood sugar, get into the habit of checking your blood sugar. And it doesn't have to be that it's only for grandma, grandpa to check their blood sugar. Please, diabetes is also discovered in the young individuals, even in those who are in active work life, early adult life. And especially I want to speak about women during pregnancy. Check your blood sugar, because that is what we call pregnancy-induced diabetes in pregnancy, gestational diabetes. And this can even cause congenital malformation in the baby if it is not detected and well controlled early enough. And also we have what we call home management, home care, blood sugar evaluation at home. What we use glucometer. Patients, should get all this, self-home care. So you can check your blood sugar at home when you wake up in the morning, after eating 2 hours, and so on. These are all the things that patient needs to be doing. And also there is what we call trend check of blood sugar, which we call glycosylated hemoglobin. Glycated hemoglobin is very essential in the diagnosis, in the prognosis, in the management of diabetes. It's done every 3 months, and every diabetic patient should be aware of this regular checking. So, and of course, screening and checking the eye, as I said earlier, diabetes affects the eye, causing blindness. And then if you don't check as a diabetic patient, you just find out that the individual wake up one day and find out that he cannot see, but that doesn't have to happen. Regular eye screening, especially every 6 months for diabetic patient, is very crucial and it's very essential. And of course, every diabetic patient, we need to also get into knowing what is the standard guidelines and protocol. All these are always written by world bodies, WHO, American College of Diabetic Association, all of them, they have them on the website. All diabetes patients should easily know what is the guideline, which means what should be my target blood sugar in the morning when I wake up, what should be my target blood sugar 2 hours after eating, what should be my target blood sugar 10 p.m. before I go to bed. All these are things that needs to be imbibed by diabetic patients. As I believe we're speaking to patients and patients to be, and then caregivers. And of course, regular attention to the follow-up clinics, attending the follow-up clinics is also important, so that complications can be picked up early by the specialists or by the attending physician, and this can be easily early intervention and early management, so that you can retard progression of complications, and even if you can't revert it, at least you can retard the progression and minimize organ damage. Of course, notable in this is the kidneys. Measurement of urine proteins, progression of measurements of urine proteins, and of course we also have self-home care for this, whereby patient can also monitor their urine protein at home. Yes, we have dipsticks. Apart from that, we have microalbumin strips that patient can use at home and in the hospital when they come along. So of course, because diabetes also is associated with the heart and other cardiovascular risk factors, also hypertension can come up. The diabetic patient, maybe 80 to 90% of them can develop hypertension, and therefore it's necessary that we immediately pick this up and manage it, because when there are double risk factors, that's hypertension with diabetes, that's a exponential risk factors on organs, the heart, the brain, causing stroke. All these complications become even more when there are more risk factors. In essence, we've spoken a lot about diabetes. One way, there was a study done whereby 5,000 adults highlighted it's of 5,000 adults with diabetes, and they highlighted the importance of family, friends, in improving the well-being of patients and the self-care management of patients. And they found out that in these 5,000 adults with diabetes, when their family, when their friends are involved, when their colleagues, that is, there are groups, there are what we call groups, whereby we have what we call diabetic groups, whereby we talk about your experience, and it tends to help in the management of diabetes. So diabetes is a journey really, and family, friends, colleagues are always involved. Please note that there are many medications available for management of diabetes, starting from tablets, oral, to insulin. So we know that all this at one point in time will be necessary in the management of this condition. When children develop diabetes, the parents are very, very much involved. You know, parents should always have a leading role when their child is diagnosed with diabetes. And as the child grows up, the child becomes well learned in how to manage himself or herself. It's not a scary condition. So diabetes is manageable, although it's not curable, but it's manageable. And when it is well managed, individual can lead a very healthy life into old age. At this point in time, I will stop, wait for comments and questions from the audience. Over to the moderator, Ms. Kemi. Thank you very much for listening, everyone.
Thank you, Dr. Ali, for that presentation. It was very insightful. You said quite a number of things that, you know, I'm sure our attendees will be able to need to take note of. You mentioned that individuals and patients that are living with diabetes should have a special food care program, and I completely agree with you on that. You also mentioned the importance of regular eye screenings, you know, because of the complications that can result from diabetes. And I think that for me, finally, one major thing that you said that sort of resonated with me, also as one who is a caregiver for someone living with diabetes, is that you mentioned that diabetes is really a journey. It's a journey, and friends and family members are involved in this journey. Diabetes is manageable. You know, it's not a scary journey with the right information, and that's the purpose of today's webinar. With the right information, diabetes is completely manageable. Thank you once again, Dr. Ali, for that insightful presentation.
Thank you, Ms. Moderator. Thank you very much.
All right, then we're going to have Dr. Ali back. We are going to have Dr. Ali back during the panel session and Q&A session. I'm sure that you have like lots of personal questions to ask, and Dr. Ali will be very happy to answer your questions today. But up next, we have our clinical nutritionist and dietitian. And I'm sure you're very, you know, we all know how important, you know, diet, eating, and things like that are, you know, to an individual that is living with diabetes. And so we have Ogwa. Ogwa, please, can you make an attempt to share your screen just for us to be sure that that will be a seamless process? I just want to be sure.
Okay,
you don't have
1 minute.
Issue. Okay.
No, I can't share my screen. The host disabled the function.
Okay, all right. So just give me 1 minute. I'm going to share it from here. Because I already tried to remove that setting, but that wasn't working. But you know, basically you will be giving a presentation on, okay, so I can take questions already. Don't worry. We are going to answer your questions. Just 1 minute. Okay. Okay. Please, can you confirm if you can see my screen?
Yes, I can.
Okay, please go ahead.
Okay, so I'm Ogwa. I'm a dietitian, clinical nutritionist. I'll be presenting on the dietary management of diabetes, and also, as much as I possibly can, talking about the role of caregivers in the management of diabetes as well, because they are very, very important. And it's something that sometimes we forget. So we end up counseling the patients and forget that when they're out of the hospital, they're with their family members that become their caregivers. So it's a good thing that we have this webinar to also talk about how important these caregivers are in the management of diabetes. Okay, so you can just start the slide.
Okay.
So I'll start
okay.
Sorry?
Okay, I just did. I'm on the first slide now.
Okay, thank you. So I'll start off by briefly going over what diabetes is. It's a metabolic disorder with very strong hereditary factors. And for a dietitian, a lot of times I hear people say that diabetes is a carbohydrate problem, or diabetes is caused because a person has eaten a lot of rice, or is caused because a person keeps taking a lot of sugary things. So I'm here to let you know that diabetes is way more than just that. It's not caused because you're eating a lot of rice or because you have a sweet tooth. It's actually more of a calorie problem than a carbohydrate problem, in the sense that you get glucose, which is the end product of carbohydrate metabolism, from every meal that you eat. So from your protein, from your fat and oil, from everything, you get glucose. So if you're saying you're going to cut off anything that has sugar, one thing I tell all my patients is, what kind of water do you want to drink, hot or cold? Because that's the only thing that doesn't have glucose at the end of the day. So we talk about type 1 diabetes, type 2 diabetes, gestational diabetes, and diabetes that can also be caused from an illness, for instance, pancreatic cancer. You know, the pancreas is the organ that produces insulin, which is the hormone that takes glucose from the blood to the cells of the body where it is needed. And in diabetes, this absorption or this transportation doesn't happen. So if a person has pancreatic cancer, that means the production of this insulin is inhibited. That can result in diabetes. Another type rather is because of a medication or maybe exposure to chemical. Now, one thing that we don't talk about is pre-diabetes, and that is why I highlighted it in a different color. At this point, a person can either move up to not being diabetic at all and just generally have a healthy life, so to say, or fall into being diabetic. And at this point, most people say, oh, I'm not diabetic, so I don't have to see a dietitian, I don't have to see a doctor, I don't need any kind of restriction. I always tell them that at this point, you're on the fence, and it's easier for you to fall into being diabetic if care isn't taken than for you to fall out. So if a person is pre-diabetic, you should actually come into the clinic, speak to your doctor, speak to your dietitian, and treat as if you were, I would give a diet as if you were already diabetic. So this table just more or less lets us know the values for instance, 2 hours postprandial, that's like 2 hours after meal. Now, the reason why this is very important for me as a dietitian is it lets me know the triggers, so to say. And because in managing patients, they are very, very individualized. So a patient might be on carrots, for instance, as a snack after a meal, and it will not raise the person's sugar level. And then I put another patient on it, and it does raise the sugar level. So one way I know if the quantities are okay, or if a person has a particular trigger, is through this 2 hours postprandial. So they check their sugar level 2 hours after every meal. So 2 hours after breakfast, 2 hours after lunch, 2 hours after dinner. You will not continue this for the rest of your life. So you don't have to be scared or think, oh, forever I'm going to be pricking myself 2 hours after every meal. No, it's just at least for the first 2 weeks, so that I know for sure if you have any triggers. And then there's the Hba1c test, which is done in the hospital. It's a bit debatable whether or not Hba1c is a bit more accurate than fasting blood sugar, but then I just say that both of them are great and are equally accurate. So move on to the signs and symptoms. I will just highlight 5 common signs and symptoms that I see at the hospital, and I would link them all together so that you see how one can cause the other. So one that I get a lot is that people with diabetes come in to say that they tend to urinate a lot. And then I see people from there say that they get hungry a lot. And then I also hear people say that, you know, they tend to lose a lot of weight. And then I see people say that they get tired easily. So how I would explain it to a patient is, now, there's a lot of glucose, so to say, moving around the body. Now, the organs or the body itself is a very smart place. So what I tell them is, because it is concentrated in the blood and more or less doesn't know what to do, it has to be filtered out of the body. So that may cause you to pee a lot. Now, because you're peeing a lot, you're losing a lot of water. You're losing a lot of everything. So the brain now knows, okay, let's make this person drink a lot of water. Then, because this glucose is not going to the cells of the body where it's needed, so the cells need glucose, and one way that they can get glucose is something that powers the body, makes the body function. So one way that they can get this glucose is when you eat. So when you eat and the glucose doesn't get to the cells, they more or less feel like, okay, maybe my owner isn't eating. So there's that, okay, start to eat so that I get glucose a lot. And because glucose is not moving into the body, it's not powering the brain, you will get tired. So that's how you can link those. So that's just a fun way, so to say, of explaining to them so that they're able to link all the symptoms together. Now, there are some risk factors, basically things that predispose a person to diabetes. I'll just mention a few. There's inactivity and obesity. environmental factors, a person's location, a person's race or ethnicity, and then there's also the hereditary factor to it. Now, apart from the risk factors, there are some complications that a diabetic patient is predisposed to, and I group them, I put them in two groups, the short term and the long term. For the short term, there are things like cardiovascular diseases, microvascular damage like poor wound healing, erectile dysfunction, and then there's the retinal damage. And then the long-term dysfunction, that's the organ dysfunction and the organ failure. It's at this point that people would say, it's sugar or you're peeing sugar, because at this point the organ that's supposed to be filtering all of this is more or less damaged or is not functioning properly. So the things that are supposed to be filtered or things that are supposed to help filter the waste, the urine, for instance, is not working. So everything is more or less just leaving the body as it's getting there. So the management of diabetes is grouped as the 3 Ds. There's a dietary management, there's a drug therapy, and then there's a daily activity. I'll be focusing more on the dietary management. The goals of the dietary management, first of all, is to normalize the sugar level, to bring it to about 70 to 110 milligrams per DL, and then to achieve weight loss within 5 to 10% weight loss. So weight loss is actually known to help control and manage the sugar level. And it's also to reduce cardiovascular risk factors and other complications that may come up as a result of diabetes. So before you comment any dietary modification or any diet at all, there are a few questions you should ask yourself. First of all, is it sustainable? Secondly, does it have things that I like to eat? Now, is it affordable? If I have to leave the country or leave the place that this dietitian is, does it have things that I can convert to meals that are found in those places? Those are the things that you ask yourself when you get any meal sheet. A diet for a diabetic patient, I have to say, is not as restrictive as we think. A lot of us feel once you're diabetic, that's the end. You are going to be subjected to a life of beans or a life of protein, so to say. No, on the contrary, a diet for a diabetic patient is beautiful and is very, very broad. You can have almost everything, actually. The thing you should just know is that we focus on the quantity and then the calorie distribution. So for carbohydrate, it's between 50 to 60%. For protein, it's between 15 to 25%. For fat, 15 to 25% as well. And fiber is usually 50%, except there's an underlying condition that would make you drop it. That's why there's that range of 30 to 50%. In developing a healthy plan, bearing in mind that the first thing to do is to make sure that the plan can help control or bring down the sugar level, and then make sure that the meal is as beautiful or, like Dr. Ali said, as colorful as possible. Now, your meal being colorful is, you're not just going to be eating a bowl of greens, like a lot of people think, or a bowl of yellow things, so to say. You're going to have a plate with as much colors as you can possibly think of. A classical example, you can have a plate of rice, for instance, and then half of your plate is probably fruit salad. And carrots. Then the other side of your plate has something equally as colorful. So at the end of the whole thing, it's not just a white plate. So
sorry, I'm going to stop sharing. Sorry, I have just muted the person. That should be Dr. Eze who is causing that disruption. Sorry about that, please.
Okay, sorry, what was the last thing you heard clearly?
We're talking about developing a healthy plan. Sorry about that. I'll go back right now.
All right, that's fine. Okay, so we should also know that developing a healthy plan is actually something that you need, whether you're diabetic or not. So, okay, before she brings up the slide, so we'll take the predominant things basically in a diabetic plate. So I said that vegetables should be about 50% of your plate. So you fill up your plate with non-starchy vegetables, which are your green leafy vegetables. You can also have peppers. Yes, your red peppers, your yellow peppers, those are your sweet peppers as well. They are very, very good. And then for protein, it's about 15 to 25%. Okay, I'm sorry, can you expand that so they can see that image at the right corner?
Okay. For the protein?
Yes, just expand it to that image that has the plates. Yes, perfect. Thank you. Thank you. So for protein, it's 1/4 of your plate. Now, bear in mind that your protein, for instance, you can eat meat, but it should be lean meat. If you want to eat chicken, it's lean chicken as well. So that's chicken without the skin. You can have goat meat, you can have crabs, you can even have milk. You know, so you can have everything. Same thing applies for your carbohydrates, for your sweet potato, for your wheat, for your rice. You can eat rice, you can eat sweet potato, you can eat Irish potato, you can eat yam. Bear in mind that this image just lets us understand that it is portion, not necessarily avoiding meal. So you can eat everything, just watch the portion. Now for your fats, the rule of thumb applies. That's so if you're going to eat avocado, for instance, you can have 1/4 of that. If you're going to make a pot of stew, it shouldn't be a case whereby we can separate the oil from the tomato paste. Or if you're making a pot of soup where you can separate the palm oil, for instance, from the food. So there shouldn't, like what I usually tell my patients is make it in such a way that when I look at your pot of stew, it's almost like there is no oil at all in your stew. So people ask me, how is it going to taste nice? It will taste beautiful. And it's a very, very great option, not just for you being diabetic, but for every person. Okay, so you can just skip to the sample menu.
Okay.
So this sample menu is for a patient on a 1,700 kilocalorie diet. Now, this menu was actually tailored to his specific needs and the things that he would normally eat. It's also tailored to his activity level, his weight, his height. So I would not say that everybody that is diabetic and is on 1,700 kilocalorie diet must use this. No, this is for a particular person to suit a particular person's need. So you can see that for breakfast, because I told him that he must have vegetable to everything that he eats. So for breakfast, he's having vegetable salad with 1 piece of flake fish. Now, so the vegetable salad that has the fiber, the flake fish that has the protein, or he can have skinless chicken, and then 1 cup of hibiscus tea. I forgot to add, he also had 6 pieces of grapes as well. Yes, and then he has a snack, which is a half cucumber and 1 medium apple. Now I matched fiber with apple because I noticed that whenever he takes apples, it causes a spike in the sugar level, but then he loves apples. So you see, he can have it, but it's just matching it with something that doesn't have a high glycemic index. So it more or less helps to cushion the effect of the glucose in apple. And then because of the fiber in it, it reduces the rate at which glucose is more or less released into the blood and all of that. So we'll just skip to the meats and fats. Okay, so I highlighted, I think, about 5 myths based on the things that I get at the hospital and things that I hear. So the most common one is that diabetic patients should not eat rice and that they should eat only wheat, eat beans, eat unripe plantain, and that rice is the enemy. So I have you know that if you tell a person not to eat rice, but eat beans or unripe plantain because it will not raise their sugar level, the beans and unripe plantain will raise their sugar level beautifully well. So they can have rice. Now, the reason why beans will not raise your sugar level as fast as rice would is because it has fiber in it. Now, I know that we group beans as a carbohydrate, as a protein rather, but then in recent times, we have actually found out that it can actually be grouped as a complex carbohydrate bound by fiber. But we leave it as the protein in the protein group because it has more protein when compared to other legumes or grains. So if you eat a lot of beans or beans products, it will raise your sugar level. So how can you eat your rice? Match it with vegetable. That fiber that is not in your rice but is in your beans is in your vegetable. Now, if you eat unripe plantain because you think, the riper the plantain gets, the more glucose it has, and then you eat unripe plantain and you don't match it properly, it will raise your sugar level as well. Another one is that people living with diabetes need to follow a special diet. I have already talked about that and how it's not a tight or a difficult diet, so to say. They can actually eat almost anything. It's just quantity and what they match what they're eating with. Now, I also hear that there's only one dangerous kind of diabetes, which is the type 1 diabetes. If a patient doesn't manage type 2 diabetes or even pre-diabetes or gestational diabetes properly, it will cause the same complications as type 1 diabetes would. And then I hear that healthy foods won't raise your blood glucose. Any food at all would raise your blood glucose. The only thing that will not raise your blood glucose is water. And then the last one is that people with diabetes should not eat yam, but should eat sweet potato. Now, if you speak to somebody that understands glycemic index, that is the ability of a particular food to raise the sugar level, the rate at which a particular food can raise sugar level, you won't get this because now yam has a low glycemic index. That means the rate at which it will raise the sugar level is quite low. The glycemic index for yam is 33. Before I go to what the glycemic index for sweet potato is, now for a food to be termed as high glycemic index, so to say, it should be higher or greater than 70. Sweet potatoes glycemic index is 88. Now, I'm not saying that if you're a diabetic, you shouldn't eat sweet potato. You can eat sweet potato, but it's what you match it with. So telling the person not to eat yam, but to eat only sweet potato because sweet potato has more fiber will just cause the person's sugar level to skyrocket as well. So if you're going to eat yam, match it properly with your vegetable. If you're going to eat sweet potato, the same thing. Now, the quantity will also differ. So after talking about the myths, something that I noticed that we don't talk about is hypoglycemia. And that's when a person's sugar level drops below the normal range. And then the common one that we see is excessive sweat or fatigue or dizziness or something. Now, one way that I know everybody handles hypoglycemia is by drinking a bottle of Coke. So there are a lot of other ways to handle or help a person that is going through a hypoglycemic crisis, so to say. Now, you can take a food that has a high glycemic index. That's a food that would raise the sugar level, has the ability to raise the sugar level fast. Two very beautiful and common examples are pineapple and mango. You can have glucose, or you can have a teaspoon of honey, half a cube of sugar. You can have fruit juice. Then you can have the carbonated drink, which is about half a cup or a quarter of a cup. So downing a whole bottle of carbonated drink or Coke because you're trying to help a person can be more dangerous, actually. So after talking about diabetes and hypoglycemia, I'll talk about the role of the caregivers. Now, caregivers are extremely important, and it goes beyond the clinical team, because the patient or the client spends more time with their family members than they do with the clinical team. If you're on admission, you're going to be discharged soon. And if you're an outpatient, after the consultation, you're going back home. So it would be really nice for the caregivers to come in during consultation. If you can, if it's okay for you to come in, it would be great if you can be part of the counseling process so that you know the nitty-gritties. It's also nice for you to encourage this person to exercise as much as they possibly can, preferably 30 to 45 minutes every day. Encourage them to have a lot of fruits and vegetables with all their meals. Now, I also have to say this, that if a person in your house is diabetic and the person is eating, say, a plate of rice and vegetable, it's very unfair for you, because you're not diabetic or because you don't have to watch the portion, to open a box of pizza or have a big bowl of the person's or something else in front of the person. Now, you're just going to make following the diet or the restrictions very difficult for that person. So you can actually eat what the person is eating, maybe not the quantity, but you can eat the same meal or something similar. Now, I'm not saying you can't have your pizza or your ice cream, but it shouldn't be a case whereby it's tempting to the person, so to say, especially if the person is told to cut it out for a period of time. Now, you can also be careful what you tell the patients when you check Google, because Google has a lot of answers to a lot of questions, but not all of them are true. In fact, most of them are not true. So before you pass information to the patient, please consult the doctor or the dietitian handling that particular case first. So in conclusion, diabetes is actually a disease that can be managed. It can't be cured. It can just be managed. It is not a death sentence. And the diet that a diabetic patient is placed on is not a punishment. It's actually a very fun diet. It's a very colorful diet that has everything that they would probably want to eat, snacks inclusive. And then the management of diabetes is not a one person approach. It's a multidisciplinary approach. So it includes the doctors, the pharmacists, the nurses, the caregivers, and all of that. So thank you very much for this. Please, can you scroll up a bit? I want to be sure I saw. Okay, yes, I did. Thank you very much for listening.
Okay. Thank you for this. Thank you for the presentation. Let me quickly check the chat box. Okay, I can see questions for the dietitian. Please, we are coming to your questions. All your questions will be answered. We're going to answer all your questions. So please be rest assured that we're going to answer every question. We're now moving to the panel session. I like to refer to this session as, the most exciting part of today's event. But just to quickly touch on a few things that our clinical nutritionist and dietitian spoke about. For those that don't know, Ogwa is actually the clinical nutritionist and dietitian at Lagos Executive Cardiovascular Center. And as we progress in today's webinar, we will share with you definitely how to reach her. But what you can do right now is to go on Instagram and connect with LECC as well as Clina-Lancet Laboratories is at LEC Center on Instagram, and Clina-Lancet Laboratories is as Clina-Lancet on Instagram. Please endeavor to follow these two accounts on Instagram as well as on Twitter, because we have a lot more coming your way. We have a lot more webinars, even like a free meal plan. We have there's a diabetes guide as well, a book that will be sent to your email for you to have. So there's just so much for you to learn and for you to gain as a result of that. So just to summarize a few things that Ogwa shared during her session. She had mentioned that not one size fits all. And I remember that just while we were preparing for this presentation during the rehearsal, and she had said she was very skeptical about sharing a meal plan during this presentation. Why? Is because many people may screenshot and say, this is the exact plan I want to go and use for myself. This is the plan I want to use for my family members. So please let's note that, each plan is specific to the individual. There is no one size that fits all. It's also good for us to know that not all healthy foods will reduce your blood glucose. So she had mentioned how that a patient, would eat apple and would raise his blood glucose. That's why I like to encourage, people to be very involved in their health. Monitor your blood glucose. Okay, don't forget, Dr. Ali spoke about it. But let me not go too far. Let's just, talk about all these things during the panel session. I'm going to invite our panelists right away. The first panelist is Dr. Folashade Ali, the Chief Medical Director of Lagos Executive Cardiovascular Center. She was our first presenter for today's webinar. Dr. Ali, are you on the call, please? Okay, so we're going to wait for Dr. Ali to turn on our video to join this panel session. Our second panelist is, okay, I can hear Dr. Ali already. Our second panelist is Dr. Kenechi Adinu. She is a medical doctor and clinical researcher at Clina-Lancet Laboratories. Hi, Dr. Kenechi.
Hello.
Okay, so we're going to wait for the... Okay, all right then. Thank you so much for joining us. And then our third panelist is Ogwa Onwigbe. She's the clinical nutritionist and dietitian at Lagos Executive Cardiovascular Center. Hi, Ogwa. She just had a presentation.
Hello.
All right then. Dr. Kinechi, please can you turn on your video so that we're sure that all panelists have their videos on as we direct questions. All right, thank you. Dr. Ali, in just 30 seconds, I'd like you to answer our first question. Can diabetes be cured permanently?
No.
Dr. Ali, that question is for you, please.
The answer is no.
No, this is the one that...
Okay, so I mean, Dr. Ali, there's so much that we see on social media and on WhatsApp where people like share WhatsApp pieces and say that, or even like on the road, you see megaphones and people standing and saying, cure your diabetes for life, cure this medicine, go cure them. So are you saying that all of these things are false and diabetes cannot be cured permanently?
They are false. It cannot be cured permanently.
They are. Okay, thank you very much for that. So now I'm going to direct my next question at Ogwa. Now, a lot of people, when they think of, well, there's a myth, I like to call it a myth, but I mean, you can definitely provide clarity on that because you are the expert here. People say that Nigerian foods are not healthy. And then another school of thought says that, oh, if I have to eat healthy, these Nigerian foods are not healthy. I have to buy like expensive foreign foods. I have to go to like the supermarkets to buy like the prawns. I don't know if prawns are good for diabetic patients. So please share with us, are there certain Nigerian foods diabetic patients need to avoid completely, like fufu? Me, I've heard fufu is the gas so when it comes to diabetes.
Okay, so Nigerian meals are extremely healthy. They are very, very nutrient packed. Now, what can make it unhealthy is a few things rather. Method of preparation, combination, what you add to it, and the quantity. For every broccoli, so to say, there's an equal and opposite ugu to go. For every lettuce, there's bitter leaf, there's shoko, there's worowo, there's tete. For every chickpea rather, there's beans. So healthy is actually very affordable, and Nigerian meals are extremely healthy.
Okay, so what I hear you say from this is that what diabetic patients and caregivers need to take note of is how these meals are being prepared. You shared earlier during your presentation that, an average Yoruba person, well, I'm Yoruba, so it's not even a diss to Yoruba people. When we prepare our stew, the bucket of it, like half of it is palm oil. Then the remaining half, you have the stew. So it's not healthy for us to cook our meals this way, right?
No, it's not. So the oil you're using is not unhealthy.
Okay.
It's the amount that you're taking in that is unhealthy. Sorry, I just have to mention that a lot of times people think that healthy oils are vegetable oil or coconut oil. No, every vegetable oil is healthy, and every vegetable oil is cholesterol free. Cholesterol is gotten from animals, not plants. So vegetable oil, every kind, is actually healthy. Now, I will not recommend coconut oil because it has its heating point, so to say, is I think 100, and other vegetable oils can go higher than that. So every vegetable oil is healthy. Like I said, the rule of thumb applies for oil, for instance. So for my Yoruba people, take it easy with the oil.
Definitely, we need to take it easy. We need to take it easy. So let me direct my next question at Dr. Kenichi. Now, I remember that, a few years back, before I had any family member living with diabetes, I remember that I would always, when I think of diabetes or I hear of diabetes, I would always liken diabetes to insulin. So you regularly hear, oh, I'm diabetic, I have to take insulin. So do all diabetic patients need to take insulin? And I mean, how did that even come about in the first place?
Okay, all diabetes need to take insulin. Insulin is for some specific group of people. Like there are different types of diabetes. There's type 1 diabetes mellitus and there's type 2. So in type 2 diabetes mellitus, there's deficiency in
We're
insulin.
struggling to hear you clearly, please. Your voice is quite low and it's tough for us to pick what you're saying.
All right, I will increase my volume. In type 1 diabetes mellitus, there's decrease in insulin. There's insulin insufficiency. So people with type 1 diabetes needs to be on insulin. So not everybody, like people who have type 2 diabetes, usually take oral medications. They don't need to take insulin. Also, people who have like ketoacidosis, other complications of diabetes mellitus are usually placed on insulin. If you have to have a surgery and you're diabetic, you're placed on insulin to manage your glucose level. Also, you manage with oral medications and your insulin level is not going, you're not getting a good glycemic control, you will be placed on insulin. So these are the key group of people living with diabetes mellitus that needs to be on insulin. That needs to be on insulin. Thank you. And I forgot
All
to
right,
mention,
then. Thank you very
there's
much.
this entity called latent immune diabetes or GOUT. So that for
Sorry,
short.
Dr. Kenichi, I think we may need to come back to you. Your network is we're really, really struggling to get clearly what you're saying. So we'll just let you put your internet together and then we'll come back to you during the next set of questions, please. Okay, thank you. We really struggled. We struggled to hear you clearly on that one. My next question is to Dr. Ali. I know that you already touched on, the complications of diabetes, what can happen to individuals that are living with diabetes. However, we know very clearly that diabetic patients are also at risk of developing stroke. Now, why and what can diabetics do to reduce their risk? And I mean, aside from stroke, you listed out a couple of other complications that can result. You talk about, the eye, going for regular eye tests and so much more. But what can they do on a daily basis to know that, I'm beginning to notice complications and this is what I need to do?
Thank you, Ms. Moderator. Well, I said earlier, diabetes it's a long life thing, and so therefore it's a long life life. It's a journey. Therefore, what you do on an everyday basis.
Dr. Ali, please, can you turn on your video and move very closely to your laptop or your device so that we can hear you clearly?
Okay, I'm so close to my device now. So as I've said, diabetes is a long life journey. It's a life journey. And therefore, what you do on a day-to-day basis counts. What counts is what you do on a day-to-day basis. Having to be proactive on what you do every day. As we have all saying, what you eat, your activity level, checking your blood sugar, checking your blood pressure, being conscious, being proactive, having a conscious mind that, look, this condition is there. I need to do this. I need to do that. I make sure I do this for myself. So it's an everyday event. It doesn't have to weigh you down. Or we're just simply saying proactive, to be proactive and to do the needful every day. That is what counts, and those are the things that reduce the risk of developing these end organ complications of stroke, heart failure, or heart attack. They are susceptible. For example, if you wake up, if you are a diabetes patient, check your blood sugar, check your blood pressure, have a record. Have a recording modalities whereby you can see the trend of what your blood sugar is on a day-to-day basis. You can't check it every day and decide that, okay, 3 times in a week I'll check my fasting blood sugar or that kind of thing. And I always encourage my patient to have a like a diary that you can write them, everything. Write your blood pressure, and so when you are coming to the clinic, you get into the habit of following up with the specialist or with your physician when they give you your follow-up visit. So take your diary down to the doctor and let him or her see the flow trend with you. And as I said earlier, another way of checking, making sure you check is your glycosylated hemoglobin, Hba1c. It's been known by the world bodies that Hba1c is a single index in the management of diabetes. It's very, very important. It tells the clinicians that, look, this person in the next 5 to 10 years is going to have come down with coronary heart disease from the diabetes. So it's a single entity whereby it's very important in the management, the prognosis, and the trend of diabetes management. Like oscillated, it's done every 3 months, and it's far better than checking fasting single blood sugar or 2-hour post-prank. So all the things that everyone who has been diagnosed to have diabetes should do, and of course making sure that you have ideal weight. If you are diabetic, you are overweight. You are not yet there. You can't be diabetic, which is more than what you should be. Then you are not there. Your management is not optimal until your weight is adequate. Ideal weight for your height. It's very important. These are all the things we are talking about. And by the time you do this, it is likely that even if the complications come, first it will be delayed, and if it will come, it will be mild. It will not be severe. And from there, we can quickly manage the complications. Early, I've not diabetic. I've personally treated diabetes for 30 years, and I'm involved. And they are going fine. And they're over their 80 years, and they're still kicking on, looking very nice and agile. So it's an everyday event, and I used to appreciate my patient when they do the day-to-day basis. I appreciate them for that. So I think that we have patients on this forum, they need to get into the habit of being proactive, doing what is right, eating what is right, being conscious, taking a conscious effort, making a conscious effort in their findings. I cannot overemphasize home care management enough. I cannot. Because when I'm not there, and when you document your findings, you're helping me to know how to manage you better. By documentation of your findings in the diary, and bringing it for me to see.
Thank you very much, Dr.
Thank you, Ms. Moderator.
I'm going to come back to, I know you have so much to share with regards to managing diabetes, care and management of diabetes. You've said quite a number of things, but I'd like to chip in at this point once again, because we mentioned it at the beginning of this webinar, that if you would like to see, consultants, you can visit Lagos Executive Cardiovascular Center, connect with Lagos Executive Cardiovascular Center on social media. You can also have your test done. COVID-19 is also still very much with us, and Clina-Lancet Laboratories offers these tests, COVID tests, as well as other tests. So you can go to any of their branches in Ikeja, Victoria Island, as well as outside Lagos. I just wanted to very quickly chip that in, because these two organizations, world-class healthcare organizations, are the organizers of today's webinar for the benefit of you and I. But my next question is directed to you. So people always say that with diabetic patients, and even with the sample meal plan that you shared, one of the things that I saw there, is how that the meals were at specific times. So are we saying that with diabetic patients, they need to take foods at specific times of the day? They can't eat maybe once it's 9 p.m. They have to eat their morning food. So tell us, is there a recommended eating pattern for patients that have diabetes?
Oh, okay. Can you hear me now, please?
Yes, please.
Okay, so the reason why there are specific times, or why there was a specific time on that meal sheet, is because sometimes these patients have to take their insulin and they take it at specific times. Now, some type of insulin, you take it 30 minutes before your meal. So that's why that meal sheet you saw had a particular time. Now, the reason why generally you should have a particular time to eat is it just makes it easier to manage or control and to know how much you're eating, and also to help you if you're trying to lose weight. Now, I'm not saying that if you eat late, you're going to gain weight. No, that myth has been proven to be false. Now, if you eat late, but then all through the day, you spend the whole day snacking, you can't blame that 9 p.m. dinner for the spike in your sugar level or the inability to lose weight. You will blame all the snacking that has gone on before that 9 p.m. dinner. Now, that's another reason why I usually tell my patients to have dinner at 6 or 7 p.m. Now, after they have their dinner at 6 or 7 p.m., I tell them to have their fruits afterwards, believing that they would go to bed soon. But if it's a person that stays up all night, you can have your dinner and then just have your fruits at intervals till you go to bed. So it's not like eating at 9 or eating at 10 is the reason why you're putting on weight. The reason why you're putting on weight, or the reason why there's a spike in your sugar level, is because after you have your lunch at 2, you take plantain chips, then you take raisins, then you take one coconut, then you see, there are all those tiny things inside, because you're hungry, so you're trying to keep yourself. So that's the reason why there's a spike in your sugar level, or why you're not losing weight. Another thing is the unit of insulin that you're on is usually matched to the amount of carbohydrate that you're on. So it's 1 unit of insulin to 10 grams of carbohydrates and all of that. So that's also another reason why because when you take your insulin, for instance, it helps bring down your sugar level and all of that. And then you don't eat, you're going to go hypo, because how are you going to augment or make up for what has already dropped? So that's another reason why there's a time to your meals. So if a person is not on insulin, for a pre-diabetic patient, for instance, I usually just match the breakfast, lunch, and dinner to their normal schedule. So I will not put an 8 a.m. breakfast for a person that doesn't wake up till 9 a.m. Then I'm looking for trouble. So I just match it to their normal schedules, and then they're good to go.
All right, then thank you very much for that. I'm going to direct just one final question at Dr. Kenichi before we go into the chat box to pick up questions from the audience. Dr. Kenichi, are the diabetic symptoms in men and women different? So people always say, oh, men have more severe symptoms, women have lesser symptoms than men. So do these symptoms vary in both genders?
Okay, the symptoms do not really vary across the genders. The symptoms we've discussed in this forum, so we start having that unexplained weight loss. Seeing they're hungry, they're able to food, yes, they're weight. At the same time, they want to drink a lot of water because they are thirsty, and they're urinating every time, especially at
it's quite a struggle. It's quite a struggle to hear you clearly for some reason. It's quite a struggle to hear you for some reason. I think your internet is still a bit, it's still not good. So let's just go to the questions from the audience so that we're sure that we're able to answer literally all questions. And okay, so let me just ask the first one. This person says that, is it possible to have a normal fasting blood sugar and an elevated Hba1c result? I'll direct this question at Dr. Ali. The question says, is it possible to have a normal fasting blood sugar and an elevated HbA1c result? Dr. Ali, over to you.
Yeah, it's very possible that the individual can have a normal fasting blood sugar, but an elevated HbA1c result. As I said earlier, HbA1c is the trend check, measures your blood sugar level. It's an aggregate of your blood sugar level in the preceding 3 months to that day. You understand? So if, for example, it's been your blood sugar over the more days, over the last 3 months has been very uncontrolled. Of course, when you check it, the aggregate will be high, but you could have a normal fasting for that day. And that is why it is always good to use glycosylated in profiling your patient management and prognosis. The implication of improving nutrition, and it's a very, very important useful tool.
Okay, thank you, Dr. Ali. We're going to take 2 questions directly from the audience. So I can see Mrs. Victoria. Is that Mrs. Victoria? Okay, Mr. So, yes, we're going to come to you soon. We're struggling to hear you, but we're going to come to you soon. While the internet, we'll just take a few more questions from the chat box. I can see so many of them. Okay, I can also see something from the. So Emeka, no, let me just go up because I can see lots of questions. Okay, so Oladimeji Ige directs this question at Ogwan. This question is for you. In your presentation, you said diabetic patients can eat any fruits, but portion size is very important. Does that mean I can eat banana, pineapple, watermelon, and sauce soup on daily basis? Cheers. Ogwan, did you get the question, please?
Yes, I did.
Okay, please take the question.
Diabetic patients can eat any fruit. It's just quantity. So yes, you can eat banana, no more than 2 fingers. That's all you can have, not a whole bunch of banana. You can eat banana today after your lunch and eat banana tomorrow after your dinner. You can eat watermelon, 1 slice. That's one, I don't know if it's 100 naira or that's 1 slice after a meal. Now, you can eat pineapple, but the reason why a lot of times it's not in a lot of my meal sheets is because, like I said, it has a high glycemic index. Now, if you're going to eat pineapple, usually I'll tell you half of that 1 slice, that's 100 naira slice, half of that with half a cucumber or 1 cucumber. What I'm doing is I'm matching it with something that is fiber dense, that will more or less reduce the ability or slow down the rate at which the glucose or the sugar in pineapple would raise the sugar level. So it's just matching it for, in some cases, and the quantity. So yes, you can eat banana, you can eat your watermelon, but pay attention to the quantities that I mentioned.
All right, very important. Thank you very much, Ogwan. Let me just wait while I direct a few more questions to you. This one says that, can we talk about artificial sweeteners as an alternative to sugar? I mean, please share a bit on that.
Okay, so artificial sweeteners, like, let me just mention a few that I've heard or I've seen. There's stevia, there's dates powder, there's coconut powder, there is, see, all these things, date powder, coconut powder, and the rest will raise your sugar level because it still has glucose in it. So if you go overboard with it, it will raise your sugar level. Now, when I counsel patients, there are some that tell me that, honestly, I can't do without sugar or honey. Yes, there's also a myth that people feel once you have diabetes, you can eat honey because honey is natural. A teaspoon of honey would do as much damage as a teaspoon of table sugar or white sugar or brown sugar. So when I have patients that tell me that they must have honey or sugar in there because they take tea, or we just find a way around it. We talk about frequency and then we also calculate it. So if they're going to have that, that means something else during the day or something else in the meal they're having at that time will just reduce. So it's just about matching. Now, for a person that's okay with switching, one thing that one kind that I would say is perfect for diabetic patients is stevia. I think it's called Diabetic meal, if I'm not wrong. It's stevia, really. So that's an excellent alternative for people that want to have any kind of artificial sweetener, so to say. So it's a great alternative, but a lot of that may not raise your sugar level, but then it can cause other things, really.
All right, thank you for that. Let me I'm coming back to you, Ogwan, but let me direct the next question at Dr. Ali. This person says that how does diabetes affect male fertility? Very important. Is it possible for a male patient to impregnate perfectly? And how does it also affect sexuality?
Please, moderator.
Dr. Ali?
Yes, can you hear me? Okay, thank you very much.
Yes, we can hear you.
Yes, diabetes affecting male fertility, isn't it? Yes, of course, diabetes can affect fertility both in male and in female alike. And of course, diabetes affect blood vessels. And for a male performance, you need the blood vessel to help the turgidity of the penile shaft and so on. So, but diabetes, there is atherosclerosis, and there is ability, perfusion of the penile shaft, and so all this can lead to what we call impotence in the male patient. And of course, for the female patient, diabetes can affect the ovulation. It comes together with all kinds of infertility, then ovulation is more, germination of the fertile ovule is poor. So there is a lot of reproductive problems with diabetic patients, both male and the female. So sometimes the way we can know that a patient has diabetes has diabetes is that the patient presents in the hospital with infertility, and when you are now investigating the patient, you find that abnormal blood sugar profile or abnormal blood sugar level, or their Hba1c is very high. So that's how you tend to. So, and it's also well documented that insulin, what we call insulin sensitivity, insulin resistance, insulin, metabolism in men and women is largely affected, definitely in diabetes, and that might just be the initial problems. And the patient with the woman will not be ovulating, or the ovaries are just not surviving because they are just not healthy, and they constantly then because activity
Can we all hear Dr. Ali clearly? I'm not sure if I'm the only one who is unable to hear her.
Hello.
It looks like her microphone is glitching.
Okay. Dr. Ali, please, we are unfortunately unable to hear you clearly and learn from the nuggets you're trying to share. I would allow you, please, can you switch to a better internet option? We keep hearing like a beep sound beneath, and then we're also not able to make out exactly what you're saying. So, but I think that a summary of what you have said to us is that yes, diabetes can affect sexuality and the reproductive system. And the question I wanted to direct to you as a follow-up to that response would be, is there something that can be done about it? So, for example, when an individual finds out that he or she is diabetic, are there certain measures to take to ensure that, it doesn't affect the reproductive system, or it doesn't affect sexuality or the ability to perform, have sex and all that?
What the individual can do is what we have been talking about since. It's about yes, that's what we have been talking about. It includes your diet, proper dieting, adequate weight, exercises, taking your medications as prescribed, we're following up, and so is all that we have been saying. And especially for women who have been diagnosed with diabetes, they need to really follow up adequately so that they don't develop fetuses or babies that have congenital malformations. So all this we're talking about, if a woman must have adequate weight, it's part of insulin sensitivity. Your weight must be normal to improve your insulin sensitivity, and therefore ovulation, germination of the ovum, so normal, healthy baby. These are all important. I used to advise.
All right. Thank you very much, Dr. Ali.
The fact that you are pregnant does. Yeah. Can you hear me?
Okay.
The fact that you are pregnant.
Yes, we can hear you.
Yeah.
We can hear you, Dr. Ali, but we're going to have to answer. We're going to have to take that response for another question. And I just wanted us to specifically answer, that person's question. Let's take. I think we still have quite a number of questions here. Dr. Kenichi, please, can you confirm to us in the chat box if your internet is better at this time? Please confirm to us in the chat box if your internet is better at this time. Dr. Daudu, I don't know if you'd also like to share a few things during this panel session. Also, please drop a message in the chat box where we'll continue to take questions from our audience. Ogwan, this question is directed at you. It says that why honey is used for dressing diabetic foods, but is not allowed to be used as substitutes of sugar in food. I hope you got that quite clearly. Why is honey being used to dress diabetic foods, but you're not allowing people, we are saying rather that, diabetic patients should not take honey as a substitute for sugar?
Okay, so first of all, honey is not just used for dressing diabetic foods, it's also used for dressing in burns patients and in other injuries. Why? Because honey actually has, what I call it, medicinal properties. It has healing agents, so to say. Now, when you put it on a dressing, it's outside the body, it's outside the blood, it's outside the cells and all of that. But when you ingest it, it's digested, it's absorbed. More or less, the glucose now moves freely in the blood. It's the same thing as, let me explain it in a more relatable way. If you're thirsty, for instance, and you pour water on your body instead of drinking the water, it doesn't quench your thirst, does it? You still need to drink water. Similarly, when you put honey on a dressing or on your skin, it doesn't go into the system or have the ability to raise the sugar level. Because of the healing properties, it's very great for healing wounds, not just diabetic foods, for burns, for bed sores or injuries that come up after any kind of surgery. But when you ingest it in a particular amount that is more or less too high for you, it will raise your sugar level. So yes, you can use it to dress your wounds, you can use it in your beauty products, but taking it in, you might need to see a dietitian to calculate it for you if you must have it in, or just take it out of your diet completely.
All right then, thank you, Ogwan. For the next few questions, please, I'd like to encourage our speakers to answer questions in a minute or two to ensure that we take as many questions as possible. So the next question is directed still at Ogwan. This person says that, thank you for the presentation. What are other examples of healthy fats and oil apart from avocado and olive oil?
There's canola oil, there's sunflower oil, there's vegetable oil, any vegetable oil is healthy. It doesn't have to be olive oil or avocado oil. Any olive oil is healthy. Any vegetable oil.
But you mentioned earlier. But you mentioned earlier that coconut oil. Okay. All right. Okay. I think thank you so much, Mrs. Victoria, for being on this call. Please go ahead, ma.
Okay.
We can't hear you.
What about what?
Mrs. Victoria, I think you're Mrs. Victoria, please, I think your network is a bit bad. Okay, it's a bit better now. Please go ahead.
Okay, what I'm saying is that if you have a diabetes, so
I think what she said is if you have diabetes, the heartbeat of the patient is high. What causes it and what can you do about it? Yeah.
Okay. All right. Thank you, Ogma, for that. So I'm going to the other question at Dr. Ali. She's just a recap. She said that for diabetic patients, their heartbeat, whose heartbeat is higher than normal, what can be done about it? Dr. Ali, over to you.
Okay. Thank you, madam, for being part of this program. Thank you. We're sorry, but really, the diabetic people, diabetic patients, they are susceptible to many cardiovascular complications. So we have to evaluate the patient. The patient has to come and see the cardiologist so that we can exclude many complications, cardiovascular complications. Possibly the patient has heart failure. Possibly the patient has other complication of cardiovascular complication of diabetes, autonomic neuropathy. There are so many things. Even hypoglycemia can cause tachycardia. So the patient has to come for proper evaluation, and from the evaluation we'll be able to know why this person has the resting tachycardia. High cause. There are many causes, madam. Blood sugar may be low, autonomic neuropathy, heart failure, so many. So, but the person has to show up to the cardiologist, so we know, okay, this is the cause of that resting tachycardia. You understand, ma'am? Can you hear me?
Yes.
Yes.
Can you hear me?
When sometimes the diabetic patients in the night cannot sleep, what causes it? That is the
Okay. She asked that Mrs. Victoria asked that what happens when a diabetic patient finds it very difficult to sleep at night.
Okay. Of course, we also, they can also have that problem, poor sleep. Diabetes, blood sugar. Blood sugar is necessary for the brain cells. Blood sugar is necessary for the brain cells. If the blood sugar is high, the brain cells are not getting enough blood sugar, so they cannot sleep, they cannot rest. So therefore, the person will not even be able to have a good sleep. So also, if the blood sugar is low, brain cell is also not getting enough sugar. Therefore, so as we said earlier, evaluation, when the patient that we have diabetes cannot sleep, from the doctor, the specialist, they'll be able to identify what is the underlying, the fundamental problem this diabetic patient. If it is high blood sugar, we get it controlled. If it is low blood sugar, because the person can have too low blood sugar while sleeping, and we're having white dreams, and having the kind of masquerade chasing the person cannot sleep. These are all the things that can happen. So you need to present yourself, and then we investigate, and then we decide, okay, it is due to high blood sugar, low blood sugar, not enough water, because blood sugar also has water metabolism, part of it. So one of them, we'll be able to find out what the problem, and we'll be able to correct.
Okay, thank you.
Hello, madam, can you hear me?
Thank you very much. Yes. So, Mrs. Victoria, I think that what Dr. Ali has clearly shared with us is that for the two major questions that you shared, it's important to visit the specialists to be able to evaluate and be sure that what exactly is happening and why are these symptoms showing up. I don't know if Dr. Daudu has anything to share or anything to say about these questions that we have been asked.
very much,
Okay.
Kemi. I think that Dr. Ali has answered them quite aptly, just basically to say, in arriving at whatever the root cause is for your sleeplessness or anything like that, you definitely have to have corresponding tests that Dr. Ali would use to make her decision in the type of management for your conditions. And that all these are available at Clina-Lancet. And also to reiterate, like what she said earlier, there are some there are some people that have diabetes that don't even know they have diabetes. And that's where the importance of regular wellness checks come in. So even if it's every 6 months that you have a wellness check, that might be the point where you pick up this condition, and then you have to follow on by going to see your doctor in the hospital for management. Those are basically the things I wanted to add.
Okay, thank you very much, Dr. Daudu. And as we round off today, which I mean, we're going to do in the next 10 minutes to close this webinar, we definitely have yourself as well as the Chief Operating Officer of Lagos Executive Cardiovascular Center, share a bit more about how, those on the call can reach Clina-Lancet Laboratories as well as LECC after today's event.
Hello, Ms.
So let me just take a few more questions. Yes, please.
Yes, there's a question on diabetes insipidus and diabetes mellitus. That somebody has that answer that asked that question.
Yes. Yes.
Slightly different from diabetes mellitus. Diabetes insipidus.
Okay, please go ahead to answer.
Can be is mainly due to vasopressin antidiuretic hormone abnormality, which can be from the brain or from the kidneys, nephrogenic or central. So they are both two different entities of disease states. Why diabetes mellitus is to do with insulin, but diabetes insipidus is to do with antidiuretic hormone vasopressin abnormality. So the person should get, he if he's a patient, himself or herself evaluated by the specialist. Thank you.
All right, thank you. Let me take just 2 more questions. Okay.
I would like to know what is the difference between diabetic 1 and 2.
Okay. Okay, diabetes type 1 and diabetes type 2. The type 1, as I said earlier, is due to absolute deficiency of insulin. The pancreas of the young child has been wiped out. We don't know what. It's due to autoimmune, but the pancreas, the B cells, the beta cell that secretes insulin, the pancreas of the young child has been wiped out. In fact, we know that there's no beta cells. The cells that produces insulin is wiped off. Nothing. So no insulin production. Therefore, they are dependent on insulin. That's why we call insulin dependent type 1. But type 2, which happens in a much older person, oftentimes, although we have pediatric patients now in type 2 diabetes because of gross obesity. And that one, there is a lot of insulin. But tissues cannot recognize the insulin that is circulating. They can't make use of the insulin that is circulating. And therefore, there's a lot of there's high blood sugar. So in one, there is absent, no insulin. In another, there is insulin, but the insulin and the body, they are no longer seeing themselves because of a lot of issues.
Thank you very much.
All right, thank you. Let's just take 3 more questions, please, from the chat box. We'll be able to take just 3 more questions. We're running out of time. It's to 6. I think we're hoping to finish this event at 5:30, but it's 5:37 now. So let me just take 3 more questions. I'm going to direct this question at Dr. Kenechi. So Dr. Kenechi, this person says that what are the effects of food supplements on diabetes?
Okay, food supplements, it all depends on what type of food supplements we're talking about. So ideally, vitamins, multivitamins are good for the body. They help with the immune system. And you know that one diabetic is prone to infections, recurrent infections. So come down with infections. So that's from the angle you can look at it. So food supplement, when the food supplements are multivitamins, are healthy, they are who is diabetic.
Okay, Dr. Kenichi, it was still a struggle to hear you, but I think we got clearly that it depends on what kind of food supplement, what kind of supplement that is. So just 2 more questions and we can call it a day. LECC has a free diabetes guide for everyone that attended, actually for everyone who registered for this event, that will be communicated and shared with you via email. So, not to worry, a very detailed guide. Clina-Lancet will also share with you a few materials after today's webinar. So, okay, Jerome says that children, I'm going to direct this question at Ogwa. Children are always cautioned by some parents not to add sugar to their tea because they will have diabetes. Is that statement medically correct, Ogwa?
No, it's not. It's very, very wrong. Except your child is diabetic or has any condition that you need to restrict the amount of glucose that the person gets. It's a very wrong thing to say. Children actually need the glucose because they are very, very active. And one way to fuel that activity or one way to fuel their brain, because it's still developing and they're doing a lot of mental work at that time, is actually through this sugar, so to say, that they are taking. Now, what you can do is ensure that they don't have a lot of it. So they can put sugar in their tea, their custard, their pap, their quick out and all of that. But then one thing I always say, when people say restrict sugar intake, then I say, do you also restrict ice cream intake? Do you also restrict donut intake? Do you also restrict Ribena intake and the rest? So yeah, they can have sugar in their tea, just not a lot of it because they do need it.
Okay. Still more questions coming. Well, let's just share one more question with you. One last question with you. Sorry, I saw that. Okay, yam with palm oil is said to be well tolerated by diabetes mellitus 2 patients.
Okay.
Research has also shown that the only but is glycerol from the palm oil. I mean, I don't know if that question was clear to you.
Okay, so I said something earlier that a lot of times people say the most dangerous kind of diabetes is the type 1. I think I mentioned something like that earlier in one of the myths. And so if you have prediabetes, type 2, any other one, you can have it. Now, if you keep taking that yam and palm oil, it will raise your sugar level. It will not bring down your sugar level. Why? Yes, yam has a low glycemic index, but it still has glucose in it. It still has sugar in it. So what are you matching with that yam to more or less mop up that glucose? Palm oil has no fiber in it. 0 fiber. It's not a vegetable. And excessive consumption of all these oils, even if they are healthy, can be converted into something that can cause a problem for the cholesterol and all of that. Now, excess of that can be converted into glucose. So what are you going to use to mop up this glucose? You need fiber. So palm oil and sugar is a terrible way. Now, I also said that you should be careful what you study. So you go on Google and you see a lot of studies. Now, when you see a particular thing that has been passed as a study or a research, check the sample size, check where it has been done practically. Is it accepted? Is it something that you have heard? Is it something that if you're diabetic, you have tried and it did not raise your sugar level? So that is a total myth. It's a big, big myth.
Okay, thank you. And just to support what Ogwan said, now this person asked in the chat box and said, please, is there anyone that is on a diabetes platform, WhatsApp, who can share the invite link? Well, I don't know if LECC or Clina-Lancet has one. I don't think so. However, like I said earlier, LECC has a comprehensive free diabetes guide, and we are going to be sharing with everyone who registered for this webinar. I have taken a look at the guide myself, and it is very, very comprehensive, you should read it once it is being sent, once it is sent rather to your email. Dr. Ali, just your final question for today. What is the risk of taking metformin or insulin on a continuous basis? Anything that can be done to remedy this?
Thank you very much. The risk of taking metformin and insulin on continuous basis. Well, the issue is that I just want to say that their benefits outweighs the risk. That is what I just wanted to start from. The benefits of using your medications outweighs every risk. That is, their benefits are innumerous, you know, and I will always, some patients will say, oh, they have that metformin causes a kidney failure. And I'm saying, where did you eat that one from? Well, University of WhatsApp, isn't it? You know, so please, people shouldn't.
University of WhatsApp.
Or University of YouTube, you know, so that is what, you know, so please, taking your medications as prescribed is of high benefit than, and it outweighs the risk. Of course, as you take them, you need to monitor your organs, you need to monitor your intake, you need to monitor, as we have been saying all along. So please don't say insulin, because some people, they don't like insulin. They don't want injection. In fact, when you give them insulin, they will say that they are dying. Some patients believe that once you want to give them insulin, they will say that death has come. Please, that should be the case. Take your insulin as prescribed. Check your level of blood sugar. Don't go into hypoglycemia. I always say that whenever you want to take insulin, check first. It is euthanasia for a patient to take insulin without checking your blood sugar first. The first thing is check your blood sugar before you take your insulin, next insulin dose. And of course, for metformin, it's good. In fact, even routinely, some patients, some pregnant patients who are infertile, who are obese, improve their insulin sensitivity just by giving them metformin on a day-to-day basis. So please, team up with your doctor, do the right thing. Don't go to University of WhatsApp and YouTube. Don't listen to others. Every management of diabetes is individualized. So please, your own case is different from the next person. Know your body, team up with your specialists, and all will be well.
Thank you very much for that. Thank you so much. This was a very, very insightful session. We'd like to get your feedback. Please drop your feedback, your comments. How did you find today's event? How did you find today's webinar? Please share with us in the comment section. We'd love to hear from you. If you would love to reach out to our panelists after today's session, they will drop their email addresses in the chat box. Please, Dr. Ali Ogwa and Dr. Kenichi, please share your Thank you very much. Please share your email address in the chat box so that people can reach out to you afterwards. Like I said, LECC will share a comprehensive diabetes guide with you. And then Clina-Lancet Laboratories also has, different packages, including health check packages. I'll just allow Dr. Dao to do that. I don't know if Lola Ali is on this call. I actually haven't seen her. So I don't think Lola is on this call. So Dr. Daudu, please, do you mind just telling us a bit about, how people can access the Clina-Lancet Laboratory services and to just take the vote of thanks as we finish today's event?
Thank you very much, Kemi, and thank you to all the panelists and the participants and all who have been on the call. We've also learned from our participants in the house as well. Clina-Lancet can be reached at our head office. We have offices, branches across Lagos. In Victoria Island, it's number 3 Babatunde Jose, Ofade Tokunbo Ademola. Surulere, you have it on the road that leads to Louth, number 44, Ishaga Road. In Ikeja, you have it at number 76, Mobolaji Bank Anthony, where you can get through to Clina-Lancet. We offer all the tests that are used in the management of diabetic patients, from your random blood sugar, fasting blood sugar, your 2 hours postprandial, as well as your tests that also check for complications. The Hba1c that Dr. Ali spoke about, apart from telling you how your blood sugar has been over about 2 to 3 months, it also helps you to look out for the cardiovascular risks. So people using your Hba1c, you're able to see those patients that are at risk of having a myocardial infarction, which we commonly call a heart attack in layman's language. And monitoring with your Hba1c is very important because it helps you to group and to also see the modifications that have to be made on our diabetic patients. We also have our labs in Ibadan, in Warri, Port Harcourt, and Abuja, where you can access all these tests in managing your diabetic condition. Thank you very much, everyone, for taking out the time to be with us. You've been with us for almost 2 hours. It has been a very insightful and informative session. And again, I want to thank our speakers and our panelists. Thank you so much for all the information that has been provided. Thank you, and everyone should have a good evening. Bye.
All right, bye everyone.
Bye, everyone.
Have a good evening.
Bye. Hi, Oguan.